So one of the questions that we had that was sent in was about your experience of going through cardiac rehab. One is pre-Pathway, so that'll be Marie, and the other one was part of Pathway. Simon, I know you touched on this briefly. Do you have anything else you kind of want to add about your experience of cardiac rehab and how your psychological issues were managed?
Yeah, it was quite interesting what Marie said earlier about the issue of the worrying aspect of things, and the whole thing about feeling invincible and all the rest of it when you're young and all that goes with it, and then you have the operation. Part of it for me was just listening to what the people were saying in the group, and taking on board all those different factors that were affecting all those different individuals around the table. And then the therapy itself, when it came to thinking about the little things that sort of like stay at the back of the mind and just tick away, and you eventually start to sort of think about those in more detail. It was being able to let that go completely. And one of the ways that I did it was to go walking and have my headphones on and listen to music, but also to listen to some of the stuff that I was given as part of the trial. And it really helped. I don't worry about anything these days. It's frightening, actually, in that respect. But it's one of those things, I think you've got to go into it with an open mind. And don't get blinkered at the start. You've got to listen and take part and get involved in it. And it's worthwhile.
Great. I'm glad you're still able to apply some of the things that you've been able to learn. Marie, was there anything else you wanted to add? Just make sure to unmute yourself.
The only thing I would add was the fact that the cardiac rehab I had was absolutely brilliant. But as I said, at that time, I don't think anywhere mental issues were addressed as much as they are nowadays. And I think going forward, it is a great thing to be going available to people, hopefully.
Simon, we did have a question just pop in about if you could be a little bit more specific about what you feel the therapy changed.
Oh, that's a good question. The thing that it changed for me was when you're actually when you're post-op and you sat there and you're going through your exercises and you get very tired, you sleep a hell of a lot, and that gives you a lot more time sat on the sofa. And what I would say to people is just don't make the big mistake of just turning on breakfast TV and daytime TV. Start thinking about how you actually feel, and if you can, talk to somebody who's receptive in terms of what it is the issues there are that you've got, whether it's somebody who's another person on the course with you, or even obviously the people that are running the course. But the big thing for me was to start looking at things differently, not try and put the slant on it you might have had post-op or post-event onto how you felt then. It was to sort of move it forward and start thinking a little bit more about the future rather than the now. I hope that helps.
Yeah, I think so. That's great. Thank you. So another question we had was that a patient felt that there was a lack of psychological support after a cardiac event, and this patient took part in the trial and was allocated to the control arm. What are the options? What are their options, and how will this research help them in the future? So, Adrian, would you be able to give a little bit more kind of insight on that one?
Yeah, so it's a very good point, isn't it? And I think Patrick described this beautifully when he said that, you know, routine psychological support isn't available, and certainly not the complex interventions, unless people are referred outside of cardiac rehabilitation to other specialist services such as health psychology or clinical psychology. What we've been looking at in Pathway as another study is a home-based version of the metacognitive therapy, so a self-help treatment manual. Now, I can't say at the moment whether whether this has been effective or not, and that's something that we're about to analyse. But we're looking at alternative ways of delivering this kind of intervention and making it more accessible, so that the person wouldn't necessarily have to engage in this metacognitive therapy in a health setting, in a hospital setting. It might be possible to engage in that more as a sort of self-help type intervention or online intervention. So these are all things that we're looking at in the future. We're acutely aware of the fact that treatments are only as good or are only good when people can access them and use them. So this is something we really need to look into: accessibility, dissemination, and plans are underfoot to look at the rollout of metacognitive therapy, whether that's feasible, acceptable, what the barriers might be to that, and possibly in different formats to increase accessibility.
I think we had another question come in. Yeah. This one is for Jenny. So Jenny, could you tell us a bit about what it was like to be trained in MCT as a non-mental health specialist?
I suppose I can't fully answer this. Prior to working here, I did work in mental health for about 15 years. So I wasn't fully non-mental health specialist. Obviously, I wasn't a psychologist, but I had some therapeutic background. But I can speak on behalf of my colleagues. And I think the training we were given was really thorough. There was lots of practical role play. I mean, it's a different way of speaking to patients. Really, you've got to be, it's quite specific in the words that you're using with people. So it was really interesting, and I think we all kind of took it on board and were able to be effective in the groups, but as you can see with the results. So yeah, I would say that it's as health professionals, I think it's really important that we're a lot more aware when we treat patients holistically. So working in a physical health setting shouldn't mean that you can't address mental health needs, because the patients you have will have mental health needs, be it related to their condition or otherwise. So I think, as trained professionals who, are educated to a certain level, I think it's something we can all take on board. But yeah, it was really good training. So
they were wondering if you could tell us a bit about, as a PPI member, what do you think your main kind of role or contribution to Pathway has been?
I think the main contribution that we made was to help it go forward in a language that was available to everybody. One of the things that I think we found when we started was we were sat there, we're the public, we're not academics, we're not medical people, we're not researchers, we're not statisticians, and sometimes the wording in various things was, we don't understand that. Please, can you put it in everyday English for us? And also we were asked about how we would go. Would we go to group meetings? Would we prefer individual meeting? And we put it from the patient's point of view. And sometimes when things are brought out, the patient is the last person they're told what's happening. And sometimes the patient's thoughts are not taken into account, and I think as ordinary people, if you like, we brought that into the deliverance of the Pathway programme, because we did read some things, and the technical jargon, if you like, would have been beyond most people, and we asked for that to be simplified. I think that's the best way of putting it.
No, absolutely. I think that's a great point, and kind of the importance of involving patients and public members in research. Mm-hmm. How do you think you've been able to help patients with MCT that you weren't able to before? Or maybe that wasn't available before.
Is that for me?
Yeah.
So yeah, I think really one of the things Patrick mentioned before was about areas of deprivation and how people don't necessarily uptake. And I think the thing with MCT, although it is a complex therapy, actually the delivery of it and what patients experience, and I think we kind of touched on this with Simon as well, is it's you just kind of reiterating some messages that are going to be really helpful. It's not complicated in the way in the language that's used. I think it reinforces things, you know, over the 6 different sessions, so that there's some, you know, maybe 3 or 4 main points that people really grasp and take hold of. And I think that's helpful for lots of people in, you know, with different styles of learning and understanding. And I think that that's one of the things that MCT gives.
Absolutely. Well,
Patrick's got his hand up there.
Yep. Hold on, Patrick. Yeah, go ahead. Just make sure to unmute yourself first.
Yeah, just to say that this is a one-off opportunity for patients and for clinicians. You'll in 90% of the cases, you never get to see these patients again. Yeah, can you still hear me, Laura? Yeah, brilliant. Yeah. And so you need to make the most of the opportunity. And I think what Adrian put across was very, very important, that the added benefit you get from having this therapy alongside cardiac rehabilitation is immense. And also listening to some of the patient feedback in terms of what they take away from this, the ability years on to be able to kind of draw on these skills, that's the stuff in the long term that is going to enable the NHS to kind of, you know, focus on interventions that reduce the burden over time. And the final thing that does, it improves the quality of life, because patients don't need to be coming into hospital unnecessarily. And this intervention proves that they can develop the skills to allow them to manage their condition a lot better. And I think that is absolutely commendable in terms of where we are in terms of this intervention.
Excellent. Well, thank you everyone so much for attending. We really appreciate it. A copy of the event will be available on our website at www.adept, so that's adept-ru.com, and we will be circulating a link to the presentation as well. Thank you so much.